So this patient unfortunately had a slip and fall about a week or so ago. He has a very large hematoma that's irritating his eye to a certain extent. You can see how swollen it is. There's no freezing in this right now. This is where it was ruptured a little bit. So because he's having trouble with it in his face, we're going to see if we can just open this up a little bit, evacuate what is in here. So we'd expect this to be all clot. So what should come out is like a red currant sort of jelly looking material. And then see if we can irrigate this and then stitch it closed. Now, if this wasn't here, we had an abrasion and probably a breakage of the skin here, I would try and incise it around his eyebrow just so we can hide it a bit better. But I think if we can just do a small incision here, because this is probably going to have some scarring with it anyway, maybe just as well as well. So I'm going to add some freezing here. We've already added some topical antiseptic. So here again, like if you do cyst, we want it to be very superficial. So you're going to feel a poke here. I apologize. Feel the burning. You okay?
Mm-hmm.
There, I want just the bevel to go in. The more I fill into that space, the more comfortable it is for the patient. So I'll check that freezing in 1 second. Does that hurt when I do that?
No.
This is their number 11 blade here. This is what we'd expect to come out, like a thick. Is that too uncomfortable?
No, I'm good.
So much like when we rupture cysts, what we have to look at is the tensile strength being generated by the underlying thick clotting material versus the size of the actual space we have. Try and push on that a little bit. So if I can't squeeze it out, I'm going to widen that up a bit. Just like that. I'm starting to drain. See that clotted material? You're okay?
Oh, good. But Ashley, you got to go to a different spa.
Noted.
So this is the balance between trying to see if I can get as much out as possible. There we go. I see that. That's what I want to get out. So just like with infected material, that's what we expect to get out there. You okay?
Yep.
So now I want to irrigate this, in part to clean it, but also see if we can dislodge more clot material. So I'm going to re-inflate it. It's not hurting too much?
No, I'm good.
It's good. One more time. And here I try to change the angle just a little bit. only because I'm trying to disrupt, again, clot from various walls. It's a three-dimensional structure. Sorry about getting you a bit wet.
Not to worry. I just got out of the shower.
So that looks pretty good. So you can see how that little swelling's down. So now we're just going to put in a couple of stitches through here. So then I can tell you about stitch material here. There's various types of non-absorbent stitch. You could use nylon, could use proline. A couple studies have shown, so I'm going to use proline, which is this material here. Nylon's a great substance, but some studies have shown it has a little bit more of an inflammatory effect. So in areas like the face in particular, I want to minimize that as much as possible. So in these cases, I prefer proline. So here I do my 3 loops. So I did it, I cut my thread. I pulled it through. So one of the things I could choose to do here is just trim my thread right from the beginning, because I already know I'm going to use a couple of stitches. So these I just cut a little bit short. And again, we're kind of handcuffed today because there's only one person helping me today, so she's trying to help Dad and run the camera at the same time. So again, harder to see sometimes with thin material, but this is your V set up here. So we do 3 loops around, so this locks. Grab the tail end here. Pull that. I don't want to pull it very tight, just so it lays and approximates the tissue. Otherwise we just cause unnecessary bunching. Pretty good. So I'll leave those ones alone, and then we'll see them back in a while, then do follow-up. So this is follow-up of the hematoma that we evacuated. So you can see from an anterior perspective that the alignment's good, and that's healed nicely. Since it's 2 stitches still, then we're going to take those out today, but that's a good result.
जी अच्छा जी, आज हम आप लोगों को दिखाएंगे जी, ये हमारा बॉक्स है जी, ये मेडिसिन बॉक्स है जिसके अंदर हम अपनी मेडिसिन वगैरह डालते हैं जी। मैं आपको दिखाता हूँ इसके अंदर हम कौन कौन सी मेडिसिन रखी पड़ी है अभी। ये देख सकते हैं आप कि इसके अंदर ये मल्टीपल मेडिसिन हैं जी। ये देखो, ये है जिसके अंदर मेडिसिन पड़ी, और ये बहुत ही मज़ेदार, बहुत ही कमाल का डब्बा है जी। ये आप इस तरह का डब्बा लें जी, ठीक है। इसके अंदर मेडिसिन रखें जी ताकि मज़ा आए जी। ये मेडिसिन है जी, बहुत ही कमाल की मेडिसिन है जी ये। और ये जो डब्बा है जी, ये आ जाता है आपको 100-150 रुपये का डब्बा मिल जाता है, बट मेडिसिन इसके अंदर बहुत तरीके से रखी जाती हैं जी। अभी तो इसके अंदर मेडिसिन ख़त्म हुई हुई है जी, ये देख सकते हैं आप, ठीक है। ये देखिए छनछना वजरा है जी, ठीक है जी। और ये डब्बा है जी मेडिसिन वाला जी, ठीक है। तो कमाल का डब्बा है जी, आप लोग इसे परचेज़ करें जिसके अंदर अपनी दवाइयाँ रखें जी, डब्बियाँ रखें जी, जो जिस तरह की डब्बियाँ रखनी है जी आप रखें जी। इसके अंदर इंजॉय करें जी आप, और थैंक यू जी।